Good afternoon, colleagues. I'm Dan West, and may I take the opportunity to wish any of our Welsh colleagues a very happy St. David's Day today before I start our presentation. So just briefly, as you can see there, Joe and myself doing a double act today. I'm Policy and Research Lead for Social Mobility, Access and Participation Plan at the University. And Joe takes the lead on our evaluation and evidence framework for the APP. And we are in a small team of 3 in the Access Participation Policy Research and Evaluation team. Thanks, Joe. If you just move on to our next slide. So I'm not sure if you can see our next slide. I can't currently, but I will talk through it anyway. So what we wanted to do in the session today was 3 things essentially. So to take you through the methodology that we adopted in our risk assessment or assessment of performance for submitting for the wave 1 of the APP submissions. We're going to talk a little bit also about objective setting and how we set our targets, and then before moving on to talking around evaluation and the evaluation frameworks and strategies that we employed in creating the plan. Okay, thanks, Joe. Would you be able to, yeah, thank you. So first off, I think what I wanted to say, one of the points was there's an absolute swamp of data that surrounds the APP. Just looking at the regulatory notices and guidance notices, you'll see that there's kind of several sources of information. And it's kind of easy to forget at times that we know our students really well. And we're already kind of have a strong understanding of the challenges that are faced by specific target groups within our institutions. So we kind of go into this with that level of knowledge, particularly as we've kind of recently been through TEF exercises as well, and we've been through split metrics for our student groups. So keeping it as simple as possible, focusing in on the kind of the necessary data, I think it certainly for us was a very pragmatic approach in the time that we had. So our assessment of performance was largely based, I think it was Christian referred to earlier, on the OFS APP data sets. So both the aggregated sector-wide, the public data set, and our individualized provider-specific data set. We transformed the data sets into Tableau dashboards. Christian was explaining the use of Power BI dashboards. We have Tableau here at the university, so we could explore the data, share that with key stakeholders. We mapped on additional underrepresented groups that weren't present in that in those data sets, so we could consider those in the round as well. And when we looked at our possible combinations in exploring the OFS data sets, so it was almost 1,000 possible combinations of various indicators and groups across the success and progression stages of the life cycle, which is where our challenges lie for equality of opportunity. So we kind of quickly worked out that we needed to exclude a lot of what we considered to be irrelevant combinations. So, for example, IMD 4 versus IMD 3 quintiles. So that gave us around 115 combinations to focus in on, hone in on. We then created and applied our internal risk assessment model to then to allow us to identify the kind of the most important risk manifestations or the significant risks. So we created a model which accounted for the population size of the target groups and the statistical certainty surrounding gaps, size of the gaps between target and comparator groups, the aggregated data, 4 years combined, and the latest single data point to identify both kind of persistent and emerging risks, direction of travel over the period of time covered by the data, and also how our gaps compared to both the sector and HEIs of a similar composition and mission. So essentially our competitor group institutions, those were most likely to share the UCAS application forms with. So in considering all of those factors, that gave us a risk score out of 16, which we then used to kind of identify those most critical risks to take forward into objective setting and target setting. Once those key risks were identified, we did complete an additional layer of analysis to explore intersectionality, and also to help us rule out any duplication of risks and objectives in our APP, because we know that intersectionality is critical, and that specific student groups can kind of create or kind of manifest that issue in particular. We also use the equality of opportunity risk register to understand our risks, or the risks that we identified and types of students to be targeted in our IPP compared to the national picture, and took the learnings from that exercise into our APP, and we used the UCAS end of cycle data sets, further evidence around informing around the access stage of the life cycle, and looking at potential inequalities in access and offer rates. So in kind of quite sharp contrast to what Christian was describing, our assessment of performance was only 2 pages long. We did not have a multitude of charts and graphs. We simply focused and honed in on the risks that we'd identified through our assessment of performance. Just moving on to the next slide, just a bit of an insight into our decision making on objective and target setting. So we selected our objectives and targets based on that understanding, as I explained at the start, of knowing our students, the challenges they face, the consultation exercises that we conducted in support of the development of the new plan, as well as obviously the outcomes from the risk-based model. And our target groups included students of colour, students previously in receipt of free school meals, and students with a mental health disability. Those kind of key risks to quality opportunity were transformed into a series of 6 objectives and 8 targets. So in some cases, our objectives stretch multiple risks and stages of the student life cycle, and are linked to multiple targets. So, for example, we had an objective around enabling students of colour to progress successfully through their studies and to attain the highest possible degree outcomes. And in this case, our objective and intervention strategy was seeking to address 4 key risks, and that was lower continuation and attainment rates for full and part-time students of colour, and that our progress was being measured by 4 targets. So we were grouping together as that made sense to do so. We actually defined our targets as seeking improvements to the target group outcomes and performance, as opposed to closing gaps. We wanted the target group to be the priority focus through our plan, and that was in the knowledge that whilst there can be some smaller quality gaps sometimes, but that doesn't necessarily mean that the target group's thriving. So, for example, everybody could be struggling in a particular metric or area. And this was accepted by the OFS during our telephone surgery, and we were able to kind of use that exercise to set out what we planned to do, which was very helpful. In line with OFS requirements, our targets are numerical and mostly measurable during the OFS APP dashboard. We didn't actually have any collaborative targets in our plan. We did include an objective around attainment raising in schools, but we didn't specifically set a target around that because we didn't feel comfortable with setting a target for something where so much was outside of our direct control. And again, this was accepted by the OFS. So there were kind of a number of key risks that we identified, but we didn't include in the APP. For example, I'll just briefly touch upon a couple of them. So we considered completion gaps between the target and comparator groups, but disregarded that following the assessment, because the reason for doing so was that we'd identified that there's a great similarity between these two measures, essentially tracking withdrawal over a longer time frame when we're looking at completion. And we identified that most of our students were withdrawing between year 1 and year 2, so in scope of the continuation metric. So we didn't have the repetition of setting separate objectives, targets, and intervention strategies. We also identified that fluid intersectional analysis, that the deprivation risks were largely driven through ethnicity, and because we'd had set out specific objectives, targets, intervention strategies around ethnicity, we did not then need to repeat it through having a separate IMD based objective and target. We know what was driving the IMD situation and gaps effectively. And we also rejected ABCs as a measure. 2 reasons really. Again, from the intersectional analysis, we identified the driving factors behind the ABCs gaps that manifested, that we wanted to focus specifically in on things that we felt that the readership of the APP would understand. I'm not sure that ABCs is particularly widely understood yet throughout the sector, so anybody else kind of coming to this would be completely confused by that measure. So we decided to make sure that we were focusing in on specific named groups rather than ABCs. So I hope that's helpful in terms of a bit of an overview of how we conducted our assessment performance and set our objectives and targets. And I'm going to hand over to Joe to give some hints and tips around evaluation.
Oh, thank you, Dan. And here we go. Let's see. Oh, we're having trouble moving on the presentation again. I was just about to say apologies, but we've cracked it now in terms of the presentation, but it seems to have gone a bit funny again. So I will carry on without. So apologies for that. So just to say at the outset, in the latest guidance, the OFS suggests that providers, and this is a direct quote here, might want to consider failure to meet the intended outcomes of an activity as a reportable event, and on the back of that, consider the submission of a variation request. And I think the strength of that language really shows that this time around, evaluation is very much central to the requirements of the plan and expected to be taken really seriously by providers. And just in terms of thinking about that evaluation strategy, I'm kind of going through this process as I did, really. I know I'm stating the obvious here, but in terms of developing your evaluation strategy, the first step really is considering the requirements of the guidance in regard to evaluation to ensure that your strategy meets those needs. You know, the guidance really does provide the framework that you'll need to build your strategy around. And I'm kind of saying this because I remember sitting there, you know, first time with a blank page thinking, okay, so where do I start here? But by going to the guidance and using that almost as a kind of a tick list, elements of the strategy did write themselves. So just talking now about things that we considered along the way. So, you know, play to your strengths. What's happening in your institution which can underpin your strategy and your practice? So have you got research cluster groups or evaluation champions or anything that you currently have in place that you can shout about and build on? So, you know, capturing your existing good practice. And we've developed an APP evaluation framework, which includes a toolkit and guidance and a knowledge hub and an APP data set, and we developed that to deliver a current plan. But that's very much been the cornerstone of our approach to delivering a strategy and institutional approach to evaluating the plan this time around as well. So next thing I'd say is be mindful of the resource and expertise that's available and how that expertise will grow currently. So, you know, where are you currently in regard to evaluation, and be realistic in terms of what you can expect to achieve in terms of developing your institution's practice through the lifetime of the plan. We're all at very different stages. And putting aside the debate around the feasibility of achieving causal levels of evidence, don't overpromise and don't feel you have to commit to type 3 levels of evidence if you're not ready. In our plan, we've committed to embedding type 2 and said that if a suitable opportunity arises to be part of a collaborative type 3 project, we'll look to see if it's appropriate for us to participate. So I'm thinking there around maybe if TASO doesn't call out or one of our networks, for example. We haven't promised it, we haven't promised type 3, but neither have we closed the door to it. The OFS wants a written commitment on the progress that a provider will make in building evaluation capabilities and capacities, but we have been given the space to, learn to walk before we can run. So take advantage of that. But in saying that, you do need to demonstrate some ambition. So in regard to our key principles, we looked to those key principles that outlined our approach to evaluation that we've developed through a current plan and just developed those further in line with the guidance. And those key principles for us were already based around evidence-based practice and collaboration and involvement of students in evaluation, but we also included research. And for me, existing evidence in the EU will only take you so far. You need to understand what is happening within your own institution, within your own context, and across your own student body. So there might be a stack of evidence for something that works in one institution, but it might not necessarily work in yours. And, the challenges facing a particular group of students at your institution might be just one or all of the risks that were identified through the EOR, but they might be something completely different as well. So, for those reasons, research was really important for us. The next thing I'd say is look to your networks. And, we've unprecedented levels of resource and support, which the OFS and other professional networks have developed and provide, particularly referring here to TASO and OFS guidance and toolkits. Those of us that are members of NARUPI as well have, a really rich theme of evidence and guidance to access through that network. But I would say don't forget your tracking services. I mean, ours is MREP, and they've developed their own resources. And for me, the data that sits within a tracking services and the relationships and the potential for collaboration that those tracking services bring is generally underutilized. So I would say, utilize those relationships as well. In terms of monitoring and governance, think about the processes and structures that are required to be in place in order to deliver your APP evaluation and respond to its findings and include these in your strategy. And for me, this is where I could present my vision. This is where I could kind of outline what I felt I needed to ensure that the APP evaluation that we were committing to was going to happen. And you can mitigate against the risks of evaluation not being done and secure accountability through monitoring and governance. And, the OFS expects us to respond to our findings and not just keep ploughing on with activity that's showing no evidence of impact for the duration of the plan. And, in order to do that, the steering group needs to receive updates on findings and be made aware of risks to delivery of the plan. And accountability to me is a lesson that I learned through our current plan and the strategic measures attached to it. And I think if I kind of look at those, it's pretty tricky to kind of pin down exactly who should be doing what in those. And if a number of people are responsible for delivering an intervention strategy and its evaluation without clear lines of responsibility, then no one is responsible or accountable for the work being done. So I would say get those in place. Can you move me on? Is it Dan, or have you got the presentation on? Or don't worry if you can't move it on. Oh, brilliant. That's great. Thank you. So looking now at evaluation within the intervention strategy. So the intervention strategy template offers, a broad application of the theory of change methodology. But for me, it did leave a few gaps. And you might not have a fully formed theory of change in place yet regarding your intervention strategies. And that's not something that we really had the time to do with the limitations of time in regard to wave one. But the thinking had been done as the strategies were developed. And one of my roles was looking at those intervention strategies and being very clear about what we could measure and how we were going to measure it before we committed. So, you need to ensure that you're not setting yourself up for a fall and that you can do the work that you're promising to do. If you're committing to a mixed methods evaluation strategy within your strategy, then which you should do, then you need to consider the methods and methodologies that are required and are appropriate for each activity, and present a mixed methods approach in your intervention strategies. And just make sure that those evaluation commitments are proportional. And don't forget all those other stakeholders, including student ambassadors, delivery staff, and school academic staff as well, because they're kind of rich veins of evaluation that sometimes go untapped. So also, when you're developing your intervention strategies, consider who is going to be conducting the evaluation and overseeing it. And in our case, that will be, the colleagues that are delivering the activity in the first instance, but the evaluation will be overseen by intervention strategy leads with the support of our team. And, think about that, the planning stage. What levels of expertise do your colleagues need to have? Will they require support to deliver what you're promising? And some colleagues, I'm particularly thinking about access, have kind of been doing evaluation, for years in terms of meeting AIM HEIR and UniConnect and, all those other requirements that we've had for evaluation. But post-entry through the life cycle, then some colleagues within some services and teams might not have that same level of familiarity and expertise around evaluation. And finally, I'd just say, your resources can follow later, and that's the stage that we're at now. So we've done the thinking, we've had the conversations, we've had the planning, we're very clear about what we're going to do, and now we're going to start to build the structures that will deliver a plan, and we'll shortly begin to develop the resources to monitor and evaluate. So everything is ready for September. So, we're hoping to get the terms of reference for the governance groups all signed off next week. And once that's done, we'll start to work intensively with the intervention strategy leads to develop the real, get down to the real core of the body of the work and start to flesh everything out so the resources are available and good to go in September. So, finally, I'd just kind of say don't overpromise, but I would say that this is an opportunity for those of us that have been fighting the corner for evaluation for quite a while to really drive it forward in the institution. And when I kind of saw the guidance, even I think going back to, John Blake's first evaluation address, for me, it was power to my evaluative elbow that I'd been kind of, yearning for, if you like. And, these are the commitments that do have to be met. And once you're exactly signed off your plan, then you're committed to that evaluation. And, we don't know what role TASO will play yet, or, how institutions will be held accountable for delivery of our evaluative commitments. But, given the level of focus on evaluation and evidence that's coming from John Blake and, from the top, I suspect that there will be some accountability. And I know back in September, when John Blake spoke at the Narupi convention, he kind of said that the very least he expected was a register of all the evaluation activity that providers have committed to conduct to be developed. And we don't know how a TASO clearinghouse is going to work, given the stacks and stacks, hundreds and thousands of pieces of evaluation that are going to be produced. But, I really would suggest that we prepare ourselves and get our ducks in a row to be able to meet OFS ambitions in regard to, evaluation as they currently are. So that's me, really. There we go. And yeah, apologies for all the presentation shenanigans that have gone on there. As I say, the rehearsal was perfect.
Thank you, Joe. Thank you, Dan. That's been great, and it's all been captured on the recording. So we've got the slides. So don't worry. I think we can all work through that. That's absolutely fine. So thank you very much indeed.
Right.
Excellent.